Within a few seconds of the therapist moving her fingers in front of my eyes and my following her eye with the eye movements, it went to a very early childhood memory I had of being abused by my father, of being terrorized. Let's say terrorized. He wasn't abusing me at that point, but it was the threat of it. I was very small and I was absolutely terrified. And my experience of this was something very different. I'd had many years of psychodynamic psychotherapy because I felt myself to be very small. And I saw how big he was. And my body went into this intense experience of rapid heart rate, sweating, that experience of terror. But it wasn't from an adult perspective experiencing this as a child. I was the child again. And so I had what you call an abreaction, this very big emotional response. But at the same time I was in it, I was observing it. This is what is very interesting about EMDR.
You're listening to Inner Pioneers, a podcast for curious minds who want to understand how to navigate change, crises, or simply the call for something new. Join us as we dive into real stories of transformation and learn from leading voices in psychology, science, and human development how to move through inner shifts and seasons of change. I'm Christopher Kabakis, and now let's begin pioneering. Welcome, everybody. It's my great pleasure to welcome today Dr. Laurel Parnell. Dr. Parnell, you are a real pioneer in the field of trauma healing, especially EMDR, and we will talk about that and what it means. And you're also the clinical psychologist, right, by training. You founded the Parnell Institute for Attachment-Focused EMDR, and you also are the author of 7 books, among others. I have to read all of these. So Transforming Trauma, EMDR, the first one that was also translated into German, you told me just before. Attachment-Focused EMDR, Healing Relational Trauma. Tapping In, which is about resources, I think. Then A Therapist's Guide to EMDR. Rewiring the Addicted Brain, so a book about addiction and its power, and I also want to talk about that today. And your latest book that was just released like 2 weeks ago, Releasing What Isn't Yours. And I hope we can speak about all these things that are contained in the books in the limited time that we have. A very warm welcome, Dr. Parnell.
It's my pleasure to be here with you.
Thank you. So my first question is, you have been working in trauma, in the field of trauma therapy and healing for more than 3 decades. How did you get originally interested in this field, in trauma?
Oh my goodness. So really what I've been involved with, I think, is the integration of psychology and spirituality my entire career, because I'm a longtime Buddhist practitioner, beginning meditation back in high school when I was just 17, 18. So I have that. And then because I'm really interested in the way the mind works and the way the body works and all of those things, that really brought me to psychology and psychotherapy. And then you cannot work in clinics like I did without working in trauma because it's right there. So always from the very beginning, as I was working in internships, I was working with traumatized people, from children who had been abused, then later adults who were abused in childhood. So trauma was always there. And so in those early days, I'm talking about the early 80s, there was very little out there about trauma and how to treat trauma. And my doctoral dissertation was about battering couples who have these cycles of violence. And I was very curious about, why do women go back to a battering situation when they have the financial means to leave? And I was looking at what I call psychological fusion, this enmeshment with a loss of self in the relationship. And so I've been always very interested in this, not because I was kind of coming to it out from an outside place. It's more like this is what was showing up clinically all the time. In the 80s, there was, we had the term PTSD. I remember there were Vietnam veterans who were in the clinic, and there were people I always had worked with people who had childhood abuse in their histories. But there wasn't much that we could do except for talking. And then I was trained by Francine Shapiro in 1991, and I was actually introduced to EMDR by a colleague at a meditation and yoga retreat. It was taught by my spiritual teacher, Jean Klein. And not Jean Klein. Yes, Jean Klein. I'm sorry. It was confusing because I have two teachers who taught at the same place. So I was introduced to EMDR by a colleague at a meditation and yoga retreat who she was describing it. And she was just saying, this is the greatest thing. And my clients are moving. And she said this, from psychological memory to objective memory. So what psychological memory is, according to Jean Klein, is memory that feels self-referential. This happened to me. It feels very alive and you feel very connected to it. So that's psychological memory. Objective memory, in his definition, is memory that doesn't feel connected to you personally. It happened. Often there's a kind of global view of what happened. You see yourself as part of a greater whole. And it doesn't have that personal self thing, self-definition at all. And so she was saying EMDR was shifting people from psychological to objective memory. Well, I thought that was really interesting, but I wasn't about to sign up for it because it just sounded like this very strange thing. You know, you're waving your fingers in front of somebody's eyes.
Mhm.
I was psychodynamically trained, and I also was trained at the Jung Institute of San Francisco. So I had kind of a transpersonal Jungian psychodynamic background. Anyway, there was a man who was behaving very bizarrely in our meditation. This was a meditation yoga retreat where we were working with the energy body, and it was very slow moving, very silent. And there was a man in the group who was jumping up and down and taking his clothes off, acting bizarrely. And I thought he was going to need to leave, that somehow he was decompensating. Well, what happened was my friend Garnita worked with him with EMDR. The next day he was back with the group, completely normal, functioning. And it was astonishing. So my friend Richard and I, who were both with her at lunch, both signed up for the EMDR training. Now, to give you some historical background, the first EMDR training was in 1990. This was 1991. So this was in the very early days of EMDR. There was very little research on it. And what I experienced was very powerful in the training itself. Francine Shapiro herself was not a very experienced clinician because she was a graduate student when she discovered EMDR. But she'd found the power of this eye movements or bilateral stimulation. And I'm hearing her, I'm hearing the theory. She was a very left brain oriented person. But what was powerful for me was the practicum. You choose something that isn't so disturbing to you to practice this. And so I picked a memory of being humiliated by a mean teacher when I was like, let's say 10 years old. This mean teacher called me into his classroom. It wasn't even my class. And he accused me of something I didn't do. And it was shame and humiliation. So I thought, okay, this is not so disturbing. I remember it. Within a few seconds of the therapist moving her fingers in front of my eyes and my following her eye with the eye movements, it went to a very early childhood memory I had of being abused by my father, of being terrorized. Let's say terrorized. He wasn't abusing me at that point, but it was the threat of it. I was very small and I was absolutely terrified. And my experience of this was something very different. I'd had many years of psychodynamic psychotherapy because I felt myself to be very small. And I saw how big he was. And my body went into this intense experience of rapid heart rate, sweating, that experience of terror. But it wasn't from an adult perspective experiencing this as a child. I was the child again. And so I had what you call an abreaction, this very big emotional response. But at the same time I was in it, I was observing it. This is what is very interesting about EMDR. You have a dual focus of awareness. You're in it and you're observing it. I'm having this very intense experience. It's very physiological, very somatic. And I'm thinking to myself, wow, this is really interesting. I've never had this before. and then you kind of process through this big wave and it goes up and it goes down. And then at the end, it feels like it's in the past. So that experience of it moving from psychological to objective memory was very powerful. And I felt the shift, it leave my body. And then the next practice we did, I did another one of these with my father, and again, it moved out. And what was very interesting was right after this training, I was seeing my father for the first time in 5 years. I hadn't seen him in a long time, and it was his birthday. I thought, I'll get to test the work. I'll see if I feel different. I felt completely different when I saw him. I hadn't even realized that I had been afraid of him as an adult, because what I would do is I would engage him intellectually as a defense against the fear that I felt that I was carrying as a child. What I felt was I felt myself as an adult meeting another adult. So it was a contemporary experience of my father. And it was great. I felt this softness. He wasn't the same person he was when I was growing up. He was very different. But when you're carrying the childhood traumas in your nervous system, what gets activated is that feeling that it's happening again, even if it's unconscious. And so I felt in the past the need to, engage him intellectually as a defense. The defense was no longer needed. I could relate to him as an adult to another adult. So anyway, that was my introduction to EMDR. And I thought, this stuff is amazing. I continued in my own EMDR therapy, and then I continued in the training and became a facilitator, a consultant, and then a trainer. So I've been practicing this since 1991.
Yeah, well, now we jumped right in. Just for our listeners who haven't heard about EMDR, could you just say what the 4 letters stand for?
Yes, so EMDR stands for eye movement desensitization and reprocessing.
Exactly.
So I can give you a bit of an overview of what it is and how it works. Just would that be helpful?
And before we do that, some of our listeners might be entrepreneurs and leaders in organizations and so on, and they might think, well, but trauma, isn't that a big word? Maybe it applies only to war veterans or people who were victims of car accidents and so on. And what you just shared about your own personal experience already points to the fact that we all might carry certain kind of traces of overwhelming experiences like trauma, right? Because your experience from your childhood is such an experience. Could you talk a bit more about how can we think about trauma and to whom does it apply in a way before we move then to the...
And I would say that the term trauma has been used way too much for things that really aren't trauma in the same sense, but what I will say is we can talk about large and small T traumas. I think that's helpful. So the large T traumas are the traumas that lead to the symptoms of post-traumatic stress disorder. They're like the car accidents. They're like the assaults. They're like these overwhelming experiences that create a sense of, I'm going to die. And so the kind of symptoms that come from these experiences are nightmares, flashbacks, hypervigilance, anxiety, trouble sleeping, and they impact relationships down the line. So those are the big T traumas. And EMDR has got so much research. It's one of the most researched therapies for PTSD, for these kind of big T traumas. But we also have these small T traumas. And the small T traumas are the kinds of experiences that we all have that impact our sense of self-efficacy. They impact who we are. They can be humiliations. They can be shamings. They can be bullying. They can be, for our LGBT folks, Q folks, it can be the kind of, harm you've gotten from people not being rejecting or not being loved or not being cared for. It can be just so many of these things that impact how you view yourself so that you're not living fully. And what we find with EMDR is when what we call targeting, when we go in on the image, the emotion, the body sensations, and these beliefs that get set in at the time of the trauma, and then we add eye movements or other forms of bilateral stimulation. So let me say that in the early days of EMDR, it was all eye movements. That's why it's called eye movement desensitization and reprocessing. We found that there's some people who cannot move their eyes back and forth because they have eye injuries, or they just cannot do it, or they get hypnotized, or they have seizures. They just can't do it. We found that other forms of bilateral stimulation work just as well. And that can be tapping on either arm. It can be tapping on the sides of the legs. It can be auditory stimulation. There's all kinds of forms of bilateral stimulation. I haven't used eye movements in well over 20 years.
Oh, really? Oh, okay.
Yeah, because nobody wanted to use it. When I was able to introduce other forms of bilateral stimulation, nobody wanted to do eye movements anymore.
Fascinating. So the eye movement, you already showed it several times. So it would be like moving the fingers slowly from one side to the other, and
so the eyes move from far right to far left, back and forth. And so as you're focusing on the trauma experience that's locked in the nervous system, the eyes are moving right, left, or you're tapping right, left, or you've got these little devices that buzz, that vibrate in the hands, or you have auditory stimulation that's making buzzing, beep, 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 where you can passively receive this. You don't have to be doing eye exercises, which I'll tell you, it's very hard. A lot of people cry very hard. And if they're crying, you have to keep their eyes moving through the tears.
Mm.
And it's very embarrassing to be looking at somebody crying and them saying, keep your eyes going. So you can close your eyes and passively receive the bilateral stimulation if you're holding these little buzzy things. Yeah.
And just one question. So bilateral stimulation really means that we try to stimulate the two brain hemispheres,
Yes.
one after the other. So moving between the two brain hemispheres. And how does it work? What do we know about why this has such a powerful effect on the trauma resolution?
You know, we don't really know. And this is what's interesting about it. We know it works because we have pre and post measurements, right? There are different theories and they're looking at different brain changes. So what they'd see is that before EMDR, the right hemisphere is activated. After EMDR, both hemispheres and the frontal lobes are activated. So it's changing the brain. One of the theories is that it's like REM sleep, dream sleep, right? And when we're dreaming, our brain is rapidly processing information and our eyes are moving very rapidly. So eyes are moving rapidly and we're processing information. So there's that model. And then there's another one that has to do with rhythm, and that cultures all over the world use drumming, dancing, and rhythm. And when a baby's upset, what do? You pat the baby, you rock the baby. So there's something inherently comforting about rhythm. And Bruce Perry, his theory was that when the baby is developing in utero, it's hearing the beat of the mother's heart. So comfort and rhythm gets hardwired into the developing nervous system as something that's comforting. So he said that what we do with EMDR is we activate the trauma response, the sympathetic nervous system, if you want, and then we pair it with a calming experience, which is the rhythm, and that it short circuits the trauma response. You can't have both of those at the same time. Now, that may be what's happening with the desensitization part of that. But that doesn't explain to me this rapid processing, because what happens with EMDR is you get this very rapid processing of information. Thoughts, feelings, body sensations, new memories, all kinds of spiritual stuff happens with the bilateral stimulation that is not explained with just something that's calming the nervous system. So you get a calming, a kind of desensitization, but you also get a reprocessing with new information coming and this bigger perspective arriving. So, and the other thing I will say that they don't tell you in most trainings is that people experience altered states of consciousness, and that it opens people to all kinds of other things. Angelic beings may show up. After death communications happen. People who've had near-death experiences, their spirit or soul will come back in. There's just so many of these altered states. It seems to open a portal to other states of consciousness that are like lucid dreaming. I think EMDR in some cases is very much like lucid dreaming. It's like some of the psychedelic work. But what's happening with EMDR is you're in conscious waking state at the same time you're experiencing altered states. So you're having both of those things happening. So you're very controlled and you're having these powerful experiences. So what I will say is that cultures all over the planet for thousands of years have used drumming and dancing as a way of processing traumas. You know, in the indigenous people of the Americas, all have used rattling and drumming and dancing for warriors after war as a way of healing the traumas of this. And I've been hearing this for years. from indigenous people. So, and everywhere you go across the planet, they go, oh yeah, we do that. In Africa, they obviously do that.
Uh-huh.
So, but these technologies have been lost by colonization. You know, people have come in and said, oh no, you need to do cognitive therapy. You know,
or take drugs, like, I mean, medicine drugs, no, like pharmaceutical drugs.
Yeah, or right. But your technologies that you know are invalid because they're whatever, they're old. Well, they're old, and actually some of them work pretty darn well. So anyway, that's a little bit about some of what might be going on here. I think there are multiple things that are going on.
And yes, I mean, of course, one reason why we invited you is that you're an expert in an altered state, the EMDR-based work. And of course, we do the darkness work and the psychedelic assisted work and breath work and so on. But EMDR is really a mind technology that I don't know much about. And so it's so great to hear from you how it works, and that the rhythm is so important there. And it connects very much to Tribe in our group. We have been talking a lot about Ian McGilchrist's work. And he talks a lot about this, the two brain hemispheres, and that there's an urgent need for some rebalancing or integration between the hemispheres, right? And what you just shared is that this hemispheric integration or reconnection that is possible under these states, bilateral stimulation, is what yields such a tremendous effect, right? Of processing, of release, and then of maybe memory reconsolidation as well afterwards, right? You process, and then a new memory forms, and you emerge as someone who has a different view of themselves or of the event that happened, right? Or events.
Yeah, I think very much so. I think EMDR is profoundly integrative. And I think this is what we're looking at. So trauma is stored on the right side of the brain and is left in fragmented form.
Yes.
And we don't have access to language from the traumatized experience, right? Yeah. So therapies that are language dependent are not integrating. Mm-hmm. And so what we find with EMDR, and you know, Daniel Siegel is one who speaks a lot about this, is he says that what EMDR does is it does horizontal and vertical integration. It integrates left and right hemispheres, base brain, midbrain, and frontal lobes. So we go like this and like this. It's profoundly integrative. And pre-EMDR, the person doesn't have the narrative. They often don't. Everything's very fragmented. Broca's area has been shut down. After EMDR, they can tell you what happened. They have the language and they have the narrative. But prior, it's all fragmented. So this is where so many of the therapies that are language dependent, the cognitive therapies, even some of the somatic therapies that don't integrate all of the different parts of it are missing something.
Yes. And what also spoke to me a lot is what you said, like the importance of the dual awareness, right? I'm training in my third year in somatic experiencing. And there's also the crucial role of the present self that witnesses the embodied sensations that manifest when we touch the trauma energy, the survival energy stored in the trauma, or the residual accumulated stress. Sometimes it's called like this, right? Residual accumulated stress. Peter Levine, I think, has called it like this. And that actually this combination of having your adult awareness, the mature awareness or the higher awareness, in a way to then stay present with then the charged material, that this is when things can move. And I want to bring this now to the element that we haven't mentioned yet. You upgraded the original EMDR protocol in your work, and you call it attachment-focused EMDR. And this relationship with yourself and with the therapist. Could you talk a bit about that and why you think we're missing something crucial if we just follow the technical protocol of EMDR, for example?
Yeah, let me explain a few other things. Okay. Yes. So EMDR, I'll define it really quickly. What we do with EMDR is we activate the memory network where the trauma is stored, and then we add alternating bilateral stimulation. And that sets off this rapid process effect. Thoughts, feelings, body sensations, and moves. We call it accelerated information processing. It moves super fast. So this is where it's a paradigm shift because it moves so fast. So in order to do EMDR, the person has to be stable enough. They have to have affect tolerance, and they have to have what I will call comfort with affect. So some cultures, the person may have affect tolerance, meaning their system can handle it, but it's not culturally comfortable. Right? I work in Singapore. I work with Asians a lot. It's not comfort. It's not in the culture to have strong emotions, right?
Mhm.
And they have to be willing to think and feel uncomfortable things, maybe even about family members that may be culturally not okay.
Mhm. Mhm.
EMDR works on what we call these activated memory networks. You have to have something that's activated. For example, you were hurt, you were bullied, you were shamed, you were maybe really bad things happened. Those are activated. There's an image, there's emotions, there's body sensations, and there's old beliefs that got frozen at the time. All of that's activated. Okay. What do you do if the main problem is something they didn't get? They never were loved. They were never held. They were never comforted. They had parents who maybe were traumatized by war. Maybe the parents never got that from their parents. Maybe they were, severe neglect. There's all these things, but what's predominant is the absence of. The other element of EMDR that I really emphasize is what we call resource tapping. In standard EMDR, they're calling it resource installation. It's a term I don't like because it's really not explaining what it is.
Mhm.
What resource tapping or resource installation is the use of imagination to light up resources that are within you. So a typical one is the peaceful place. Can you imagine a place that's peaceful and calm where you can feel relaxed? Standard EMDR, they call it the safe place. I found that safe is a very triggering word for somebody who's not been safe. And so standard EMDR, they're telling people, oh, you can't do it if they can't find a safe place. My experience is nonsense. We just have to find imagery that will calm the nervous system down
Mhm. Mhm.
without the word safe, because immediately people think, oh, unsafe. There isn't safety in the world, right? So let's say it's a beautiful mountain lake and they feel really calm and they, feel good. And then we add short amount of bilateral stimulation. So with the resources, what we're doing is we're looking for imagery that will calm the nervous system down, or it will provide us what we need. If it's peacefulness, we look for imagery that represents that we activate it. So when you imagine something, it's lighting up neural networks in the nervous system. And then we add a short amount of bilateral stimulation. It links it up. I think about light it up and then link it up. So light up the resource you're wanting. In what I call attachment-focused EMDR, we use 4 foundational resources before we work with anybody. Peaceful place, nurturing figures. These are figures, real or imaginary, that have a nurturing quality. They're kind, they're caring, they're loving. It can be someone they know. It can be someone from a movie or a book. It can be a spiritual figure. It can be an animal. Many people who've had significant trauma will pick an animal, a mother bear, for example. Then we have we make a list of these figures, a nurturing figure. And then when you have it well imagined and you can feel the quality, then we tap and we'll say 6 to 12, right, left, or keep going as long as it feels positive, only positive. If it should shift into negative, like they're starting to process into the trauma, we stop right away and we go back to the fully positive. So then we have protector figures. These are figures, real or imaginary, that have a protective quality. That will defend you, that will protect you. And it could be an animal like a tiger. It could be somebody they know in their life. It could be, from a movie, a lot of these superheroes. And then they imagine the figure, they feel the quality inside themselves, and then they tap to link it up and strengthen it. And then the last one of the 4 is the wise figure, a figure that represents wisdom. It could be a spiritual figure, it could be a wise figure, and it can be more than one. And then we tap that one in. So this is our team. You want to imagine them as a team. So they have a team. For what I call attachment-focused EMDR, we emphasize the resourcing before we do any trauma processing. So we're creating a sense of safety before we go in. Going back to this idea of what's missing, for somebody who's never had loving parents, what we need to do is create them in imagination. Create an ideal mother, the mother you wish you had. She's kind, she's caring, she's nurturing. And then they'll create her, imagine her, and tap her in. And then we can create whatever they need to redo their development. They need a loving family. They need a family who'll accept them for who they are. If they happen to be gay and they've had all this rejection in the family, we're going to create maybe 2 dads. Maybe you get 2 dads, who are cool and, they'll help you get through school. So whatever they need, we're going to create that in imagination so they get a good felt sense of it. And then through imagination and bilateral stimulation, fill in what they need. So this is with attachment focused EMDR. We have 5 basic principles. So we create safety. We've got to make sure they've got good safety, which includes the resourcing. It's client centered. So whatever we do, we're tailoring it to the needs of the individual. The therapeutic relationship is foundational. We're not like, okay, you do this 1, 2, 3, it's 6 sessions and you're better. For anybody who's had early childhood traumas or doesn't feel safe with a stranger, we're going to really take the time to create a therapeutic relationship so they feel cared for and connected to. And that's reparative in itself. And then we use this resourcing work that I've just described to create safety and to do the developmental repair. And then we modify the standard EMDR protocol. So the standard EMDR protocol was developed in the 1980s by Francine for her doctoral dissertation research. And it's been frozen since the 1980s. And there's been a need to evolve it. And so I've evolved it. And I just made simple changes where I got rid of a bunch of the numbers and scales. I simplified it. I streamlined it. It still has the same structure because I really like the basic structure of it. So you're not just free associating all over. You come back, you finish something. The therapist is out of the way, trusting the wisdom within the client. So, but I've streamlined it. I've made it much more client-centered. So that's what I call attachment-focused EMDR.
Yeah, wonderful. This is so rich as a methodology, and I see so many relationships to other things I came across over the years. And for example, I mean, that the therapeutic relationship or the therapeutic alliance is so important, right? I mean, when there were like studies done on the efficacy of certain methods, but in the end, what they found, it doesn't really matter so much, the method in these studies. It was very much about the therapeutic relationship, right? Which is confounding then the people who think it's the methods that actually are effective. I mean, I think they are. It's more, of course, methods that are more effective than others, but what often was found that the therapeutic relationship is so important. And then what you just shared is actually knowing about the things is just part of it. And sometimes we don't even know about it, right? Because it's very early, or as you said, because we don't even know what we're missing because we have never experienced this. In Akomi, it's called the missing experience also, right? And what you described is a corrective experience, having the nourishment that you never got, for example, and so on. Enter the felt sense, as Eugene Gentlin has called it, now the embodied sensation of something. Many people, they might know, yes, my parents were not so loving. Now I have a partner who is very loving, but it doesn't get in. They don't know how to let it in, no, the love that is there already. And so you already know that, but you cannot change it. And I would expect and hope that methods like attachment-focused EMDR and other somatic approaches like somatic experiencing and NARM and so on, that they can really help with that part. Have a new also emotional and relational reference experience, and that can be profoundly healing. Would you agree that this is it's similar in that way with body-oriented and mindfulness-based modalities?
Yeah, but it's much faster.
It's much faster. Okay.
It's much faster. There's something about the bilateral stimulation that just makes it go way faster. And
Yes.
when you're saying about the blocking, see,
Yes.
this is where I'm thinking, okay, so let's say this is such a good example of somebody who had cold, unloving parents,
Yes.
and they have a really loving partner, but they're blocking it.
Yes.
I'm going to go, okay, what's that about? And I'm going to use what we call the bridging technique to go back in time and see what it's linked to, because what it may be linked to is a belief I'm not lovable.
Yes.
Or
yes.
I don't deserve love. I'm not good enough, something, but there may be an experience attached to that. Yes. And then that is an entryway to doing the EMDR on that, you see?
And very nice, because I was thinking about a concrete case actually.
Yeah, so that's exactly where, like, okay. Interestingly enough, there was a man, it takes us right into the transpersonal, and he had this block, and his block was he couldn't connect to life fully. And it was this very strange, hard to say what it was, block, but I said, well, give me an example of it. And he said, my girlfriend is telling me how much she loves me, and I can't take it in. I said, okay, so let's go into that. So we had the resources set up. So she's saying, I love you so much. And he says, oh, there's a wall. I said, okay, let's go in on that and connect to it, feel it. It's not safe. Can't take it in, trace it back in time. So that we do what we call the bridging technique. We go back in time. Well, he goes back to a past life. He goes back to a past life. And I mean, I don't know how this is going to be taken, but he's now 4 years old. He's about to be killed in a concentration camp in Germany. This is a guy who's not Jewish, doesn't have any of this in his history. He's 4 years old. He's about to be killed, and he feels unloved and uncared for. We go in and we process this. We target and process this with EMDR, and it completely resolves. He has a spiritual experience. And it resolves, and then we go back to where we began, and his heart is open, and he can accept the love. So this is where sometimes if the therapist is open, we go back and we end up in a past life, or we end up in the womb, or we end up somewhere. And I don't have to interpret it. I just go with what has come up for the client. We have the image, the emotion, the body sensations, and the beliefs, and it's very charged. We got an entry point for EMDR, and we process it. So for him, that's where it went. And I've had many of these that go right back to past lives that the client believes is a past life. So I'm not looking for this. It's just what arises, and then we work with it.
Yeah, I think this is really fascinating. But because, of course, some people who are in a grew up in a Western tradition of individualistic materialism or so on, they would say, but that can't be true, right? How could you have experiences of past lives? Because your life only starts with, I don't know, in the womb of your mother, they would concede as much. And then after birth, of course. And so how could that happen? And I think it's in the tradition of William James, of course, in pragmatism, you would say, well, we don't need to make any statement about if it's true or not, if it helps the client, if he is being brought back to that place, right? And that memory, and there's release and processing happening. And afterwards, he or she feels better and there's something has changed. And we don't even need to know if it's true or not. But it is a very interesting question, how that can happen, right? That people have access to those experiences from the collective or intergenerational. And in the psychedelic assisted inner work that we facilitate also, these things come up as well. So of course you can process stuff from your individual biography, but sometimes it doesn't feel like it's your own personal experience. It feels like the experience of someone else, an ancestor or something collective.
Well, I mean, this is where I'm just going to talk about all of this now because this is really interesting to me, because sometimes what has happened is what's attached to you isn't yours. It could be a spirit or a soul that is attached to you, has been living connected to you, maybe your whole life. And it's imparting to you information that feels like it's yours because it's impacting your life. And so now I wrote about it in Releasing What Isn't Yours. I wrote about releasing, how to assess spirit or soul attachment and how to release them. And some of the things that I work with over the years, as if they were past life experiences, and they were past life experiences, but they may not have been the client's past life. It may have been the past life of a being that attached to my client. And I'll give you a quick example. I mean, this man I just described, it may have been his past life, but it may have been a child who had died who had attached to him. In any event, his symptoms went away. So I'm always looking at, I'm not looking to induce any of this. I'm always looking at relieving the symptoms of the client I'm working with, however that is. So a woman who had done holotropic breath work, she was actually a German woman who is in America for years. So she had been in a holotropic breath work group. And in the middle of this, she was having a very powerful experience that felt like a past life of being attacked and gang raped by a group of men. They're in a forest, she's running, and their clothing they're wearing is not of this time. She stopped the holotropic breath work because this was a horrific thing that was coming for her. But as a result, she developed symptoms of PTSD. And she was never afraid of men. She had anxiety that she never had before. And So none of this pre-existed until she did the holotropic breath work in a group setting. So this is, I really want to impart this to you because this is important.
Mm-mm.
And so in my questioning with her was, when did this begin? Did you have symptoms prior to this? Never had symptoms like this prior. So I figured it began because of something that happened in the holotropic breath work that set this thing off. What we did in terms of our EMDR work is we went in on the trauma picture that she had from that work, which was this attack by this group of men. So we processed it very much like we would any other EMDR. So imagery came in, she did repair, she said things, she fought, she did all this really good work.
Mm-hmm.
At the end, she came to a positive resolution. We did what we call install the positive cognition. I've got to and so she came to a good resolution and her symptoms went away. So was this her experience or was this an experience of someone else? So I didn't even think of that at first. First, I thought this was a past life experience that somehow had gotten evoked in the holotropic breath work. Now I think it was not her experience. I think she picked up something from someone else in her holotropic breathwork group. So this is the other thing that can happen in these groups. Other people's stuff can get lit up, they can leave them and end up sticking to somebody else in another group, in the group. So it felt like it was hers, but it wasn't hers. And the reason I don't think it was hers was because she never had these symptoms before. Mm-hmm. Right?
Mm-hmm. So this is a very important point. Just for people, again, to contextualize. So traditionally, people would have think, okay, they are introjects, right? I can take things that are not mine. For example, a parent that tells me, you are a bad girl or you're evil. And I absorb this message or this energy also, and it then is stuck in me, but actually it doesn't belong to you, right? And in therapeutic work, you would try to get out the introject and release it or get it out in some way. And now you're saying, but this extends also to things that are maybe not ours, not from our personal biographical experience, right, but maybe from past lives or maybe from other people in the same space. And then this, of course, it always raises the question, what's our ontology? So what do we think is the nature of reality? You mentioned Dan Siegel before, and he also says the mind is not just in the brain. It is in the whole body, first of all, but then it's also between us. So it's a flow of energy and information that organizes itself. And so if the mind is something like that, then of course we can be deeply affected by stuff that's happening around us. And in an altered state, like in holotropic breathwork or in a psychedelic experience, we can open up much more. The filters are removed. So we can access more of reality. But then what you just suggested is, well, then maybe if it opens up to more reality in the space around me, the people, they might have stuff. And I also might open up to that. And then somehow, and I guess I don't know if you have a theory about it, it can get attached to us, becomes part of our system. And then this needs to be worked on therapeutically again.
Well, this is a lot of what my newest book is, Releasing What Isn't Yours, Living from Your True Self Through Multidimensional Integrative Healing. And this is why so much of our view as psychotherapists is all this stuff, all your symptoms, everything is from your history.
Yes.
Well, not necessarily. Not necessarily. Some of this is coming through the lineage and our ancestry. Some of it is we're picking stuff up from all over the place. Some people are much more sensitive to that. And some people are even picking up spirits or souls that don't belong to us, that are coming. And the reasons for that, I think sometimes some people are just more sensitive to picking things up like that. And so I know that in IFS, they're talking about these things as unattached burdens, something like that. I don't like the terminology of calling these beings burdens. I just think of them as energies, and typically they're looking for help. And they're looking for someone who can help them. And I think you're right, in these open states with psychedelics or with EMDR, often these portals, these boundaries are opened up, and it's an invitation for things to attach. And And some people are just always have been more sensitive to this.
Yes, but it also points to the importance of the right set and setting, right, for especially group-based experiences, and that the space is held clean and with integrity, and that you protect the experience as much as you can, create this safe container, right? And then maybe the risk, let's say, that those things happen, kind of that bad energies get exchanged or come into the space might be reduced if the space is well held and supported. It's, as you mentioned before, like you work with the nurturing part, the protective part, the wise part, and the safe place. And of course, for example, the guides or facilitators in a psychedelic space, they are protective figures that shield the space from stuff from the outside. And the nurturing helps to support people in the individual processes, right? And well, let's hope we bring wisdom, of course, as well, but safety definitely. And so then you have the right attachment condition for good processes to happen, right? And I don't know if there's still then the risk that stuff that shouldn't be attached to people in a way gets attached. I don't know. I don't know if you have a theory about under which conditions this is more likely or might happen. And
well, I think this is where in indigenous cultures all over the planet, they do cleansing ritual before they do any kind of work like this.
yes,
So I think there needs to be real energetic cleansing of the space itself and of the
yes,
individuals. And that may mean individual work done before they come into a session like that, where they've done some of the early childhood traumas that could get released in a thing like that, or anything that is sticking to them before they go in. And then I think it's in Releasing What Isn't Yours, my book. I talk a lot about, a whole part of the book is on resourcing and energetic sovereignty, methods for developing it. We talk about the energy bubble and the grounding cord, the way to examine whether energies that don't belong to you are in your bubble and ways to release them, working with energetic cords and releasing cords that you don't want attached, maybe negative ancestry, cords that you do want, what we call the energetic containment room, where you can put things aside that you don't want in your work at all, where you're not dissociating them, you're consciously setting them aside. And then calling in resources. I think for the individuals to find their own resources, their own wise figures, their own spiritual resources that can be really of support to them in the work before going in, tapping them in, really feeling them, especially making a very clear intention about what the work is for. So I have a spiritual mentor, Jean Schneider, who I've been working with these 6 years now with, this, what I call multidimensional integrative healing. And she said it's so important in the psychedelic work to have a very specific intention and not have it too broad.
You have been emphasizing the intentionality, the importance of working with intentions, and also approaching the whole endeavor with humility and not thinking that you as a facilitator, you are the big protector or the savior or anything like that, and to work with resources before. And remember, because we have often like one-on-ones before the ceremony and afterwards, that we try to activate without having those the different types of resources, talk with people about their resources and think about people that in their lives that they love or that love them, and that they can activate those memories and take this with them into the experience, right?
I would ask which figures would be helpful to bring in with you more specifically, and to be, but I would avoid family members completely. They're too complicated. You bring in a family member, suddenly you got their stuff, or or you've got memories of when they were disappointing to you. So, right. So, yeah.
Okay, wonderful. I mean, one last thing I wanted to touch upon is you wrote about addiction as well. And some people have a misconception about what addiction is, and they also see it maybe even as a moral failure, and they don't recognize that often addictive patterns can have a trauma at its source, right? And could you speak a bit about that? And especially because they don't recognize maybe the trauma symptoms also. Working a lot, being perfectionists, being control oriented, or having certain relationship issues, like avoiding certain relationships, that those are all also symptoms, right, of trauma. And the workaholics and the others, they could be considered addicts, right, as well. And so I hope it's relevant, not just for people, of course, who have a clinical therapeutic case of addiction and with like substances like heroin or something like that, right? But also the usual alcohol consumption that is daily, or having a work or control related behavior. Could you tell us a bit more about?
Yeah, and I think let's broaden our definition. Let's look at those small T traumas. You know, the not necessarily, certainly people who've had the big stuff. Often they turn to a substance to deal with it.
Yes.
And so I'm always looking at, what is this serving for you? How is it helping you? Is it because you feel anxious, you feel uncomfortable, and it makes you feel less anxious and uncomfortable? Is it because you feel shame, or you feel embarrassed, or you feel like you're not good enough? Some of these things that are driving that, like, okay, where'd that come from? Looking at where'd that come from? And if we take this away from you, what's that going to do? Oh, now I'm going to feel too anxious. Now I'm going to feel too exposed. So we can either go in on the traumas, the small t, large T ones, and reprocess those. That's really helpful. That can begin to unplug what's driving this behavior. But we can also bring in resources. So can you think of a time when you felt good about yourself? Can you think of a time when you felt strong? Or if it's anxiety, what would help you? What resource would give you a sense of calm? You know, okay, I want to imagine doing a sport activity that I feel really good about. Okay, so imagine that. And then we add bilateral stimulation. You can either go the trauma route, where you look at what in the past is linked to the driving, you know, the need for whatever it is. And we can also go the resourcing route. So we can bring in, what is this doing for you, and what can we bring in that would also activate those same kind of networks in your nervous system? You know, calming, peace, confidence. So you can look at memories or experiences or things that represent that and activate them in imagination. And then the bilateral stimulation will link them in.
And would you say that social media addiction and scrolling all day is also potentially an addiction that is not just there because it was purposefully designed to make you addicted by the companies, right? But also because it catches us in some kind of unprocessed, these modern forms of addiction.
Yeah, it absolutely could be. So what I would look at is, okay, what would you feel if you stopped doing this? You know, anxious, you know, I don't know what to do with myself. Even imagining you can't have your phone for a day. Now, what is that activated in you? If it's anxiety, is like, okay, what's that about? And I think this is where the mindfulness inquiry is so important. It's bringing curiosity and inquiry instead of criticism, right? Like, oh, rather than I shouldn't be addicted to this, I shouldn't be dependent. It's like, okay, well, what's that about? What would happen if you didn't have your phone for a day? Let's explore what you would feel. I feel lost. I feel lonely. Okay, so what can we bring in through imagination, or what in the past is that linked to?
And I mean, you added before like a fascinating kind of option for people, because you said like, so maybe the addiction is being driven by the energy, the trauma energy. And then people might say, but I had a happy childhood and I don't have traumatic experience and so on. I mean, that might be that they have forgotten it or pushed it away, suppressed it. But it might also be that the origin is actually coming from somewhere else. The possibility that it might be from a previous life or from someone else. Probably most people haven't thought about that. And so you would only uncover that basically when doing the work you do, or other somatic work, or other
Well, I think what's important about what I call multidimensional integrative healing is our lens has expanded to what might this be. It could be from the personal history. It could be from really early childhood things. It could be from energies that you're picking up. It could be from some of the ancestral stuff that's coming through. There's a lot of different possibilities. And I think when the therapist has an open mind and invites this kind of inquiry and questions. And I would also say that we discount some of the small t stuff, the bullying, the disrespect, the feeling like you don't fit, the mean teachers, the humiliations that maybe one experiences that just feel like they're not traumas. They don't feel like traumas, but they impact our self-efficacy and they impact how we view ourselves. And so we make conclusions. I'm stupid. I'm not good enough. I'm a disappointment. I'm a failure. So there's certain self-constructs that develop that get reinforced over time that feel like this is who I am. And that's why I've got to work so hard to prove myself, because otherwise other people will see that I'm this failure.
Mm-hmm. Okay, Dr. Parnell, I think we scratched only the surface, but in order to respect your time, I would end the conversation here. But if people want to learn more about what you shared, where would you point them?
So my website, parnellemdr.com. My books, this is Releasing What Isn't Yours. It's just out. And there's also an audio program. Attachment-focused EMDR. Tapping in is for the general public, as is Releasing What Isn't Yours.
Mm-hmm.
So yeah, check out our website and other materials that we have. I also have demonstration videos. It shows what it looks like, what the work looks like, which is really different. And, we have to evolve these things. And I'm excited about the evolution of the field right now, that is expanding, and our understanding of ways to help people is expanding. That's really exciting to me.
Yes, yeah, to me as well. I think the kind of progress sometimes is just unlearning old limitations, right? Old habits and places where you were not allowed to go. And I think there's a lot of movement now and new openness for different kinds of modalities. And you have been really a pioneer in your field and bring so many things together to create something really special. And as you shared, very fast. So you don't need to do 10 years or 20 years of talk-based therapy or so on. I mean,
right.
They are more focused, faster approaches if the conditions are right. And that it's all the things that you mentioned that need to be there to have like a really impactful and lasting effect on people. So yeah, thank you for the work that you're doing. Thank you for sharing today glimpses of this realm of trauma healing. I hope people found something interesting in here. I'm sure at one point we will continue the conversation.
My pleasure. This has been a delight. Thank you.
Thank you. Thanks so much for listening to Inner Pioneers. If you found this conversation meaningful, don't forget to subscribe and share it with someone you care about. Want to go deeper? Visit evolute-institute.com. Until then, keep pioneering, one step at a time.